Welcome to another episode of Med Talk Show, and thank you for joining us today. I'm your host, Veronica Kaveza. In this episode, we dive into a topic that affects every single one of us: mental health. Mental health is a subject that transcends background, boundaries, and cultures, and it demands our attention now more than ever. Together with my guest, Joseph, we are going to explore the importance of mental well-being, the impact of mental health on our youth today, and the significance of seeking for help when it is necessary. So, Joseph, thank you so much for creating time to be here. And you are going to help us to discuss about mental health and mental health well-being. So kindly introduce yourself, tell us who you are and what you do.
Thank you once again, Veronica. My name is Mwaura Joseph, Kenya Red Cross mental health specialist. I've worked with them for the last 2 years. And in this, we've helped tackle a few mental health problems and also debunking the myth surrounding mental health and its well-being. Yeah.
Okay. So, Joseph, what is mental health and how does it impact our daily lives?
Well, mental health includes our emotional and psychological and also social well-being. It affects how we think, how we act, and how we interact with people day in, day out. So generally, it's our day-to-day life. It connects to our physical and emotional well-being. Yeah.
So, why is it so important that we take care of our mental health state?
Well, mental health state affects our physical being and vice versa. It's equally important on how we take care of our physical aspect of our health and also our mental health. Mental health can affect how physical you are, and how your physical health can also affect your mental health.
So it is interconnected.
Yes, you can't live without the other.
Mm-hmm. So we talk about mental health, and then there is mental illness. What is the difference?
The two terms are interchangeable, and at times we use both of them to describe mental health in general. And mental well-being is the state of being in control, in the state of having your emotional, psychological, and social well-being at par, while mental illness is a condition that has already been prescribed by the doctor. It has already been tackled. It has already been something that you have discussed with the mental health specialist. Now from there it becomes a mental illness.
Yeah. So what are some of the examples of mental illnesses?
Well, we have the most common one, the depression, schizophrenia, and a lot more.
Okay. So can somebody's mental health change over time?
Yes. First of all, I want to say that mental illness or mental health is not something that happens out of the blue. It's something that happens because there are some factors that has led you to be in such a situation in your mental health state. So when you seek help, when you tackle your problems, or when you have to look at your self-awareness, it has to change over time, as we said. That does not mean that if I'm diagnosed with a mental health condition, I will never change. I'll never be well. With the help of a mental health specialist, I'll be well with time.
So right now, mental health has been prioritized. Let's say since COVID-19, we have been really trying to create awareness, doing trainings, and doing sessions so that we tackle or we help people to deal with their mental health situation. But still, there are some of the myths and some of the beliefs, some misconceptions that comes when we talk about mental health. So what are some of the myths and misconceptions that you have had when during your training sessions or when you person in need of your services?
First of all, I'm grateful of our government, and our last president signed the Mental Health Act 2020, which in itself helped the mental health specialists or the mental aspects to be something not that abnormal in the country. So nowadays, when you talk about it, it's not that mythical as it used to be like 10 or 15 years ago. But some of the myths that we get is that mental health does not affect children. It does. Mental health conditions arise as from early as the age of 14. So for mental health conditions, one, they show up in your life as early as the age of 24. So how your childhood, how you grow up, what are the traumas that you faced, what are the conditions that you were brought up in, they really affect how you become as an adult, how you act around people, what are the mental conditions that you'll be, what is your mental state, is it going like to be? So some myths also say that when you're diagnosed with a mental illness, you'll never get well. That's a lie. It's a myth. You can get well over time. It's only that you have to concentrate your energy in getting yourself well. Yeah, and there are a lot more myths we can debunk later.
Okay, so for me, one of the thing I had is mental health is for the rich. Hiyo ni ugonjwa ya matajiri. The poor cannot like have depression. The poor cannot like be, like when you say, I'm going to a psychologist, I need to check on my mental health. I need to know how I'm doing mentally. People are like, hiyo ni ugonjwa wa matajiri. So yeah, so those are just some of the myths that I have come to I've heard people talk about. So in a world where technology right now is just like with us, with everything we are doing, we have social media, and most of us are on social media. I think the more they come up with the social media apps, the more people are joining and people are consuming content from social media. People are learning online. People are doing so many things, are selling products. So at the end of the day, you will find yourself on social media page, be it TikTok or Facebook or any other. So how has social media impacted our mental health, especially for the young generation?
Well, starting with your first statement, as I said earlier, it's a social well-being. It's your emotional, it's your psychological evolution. Mental illness or mental health disorders, this is not a thing for the rich. Ina affect kila msee. Whether uko hapa chini, as the term used, hustler, ama whether wewe ni punk, ina affect kila msee. It's not a thing that mimi nikifika pale juu, that's when I start having mental conditions. It affects us day in, day out. When you're stressed about not having school fees, that's a mental illness. That's a mental condition. When you're stressed because your kids don't have 1, 2, 3, 4. When you're stressed that you don't have a job, that's a condition. It's not affecting someone who is rich. It's affecting you, hapa chini. So, your illness or the mental well-being comes first, whether you are rich or poor. Si ugonjwa ati nachaguanga. The other thing, the age of social media or technology, it has its pros and cons. Its pros, it has helped us in a great mile to tackle the issue on mental health and its well-being. There are a lot of mental health activists online, and there are a lot of people helping to debunk and to tackle this topic on mental health well-being. So in its own way, it's a plus for us. On the other hand, we have no control on what you're using or what the content that you're consuming. It affects a lot how you act in your life. For example, una get kupata that the social media pressure. You get wasee anataka kufanana na celeb fulani. You don't know if this is a facade someone is putting online for cloud chasing. So unataka kuishi ile maisha, and maybe your current situation does not allow you to do that. So this is also a ball that we need to throw on the social media mongols or the celebrities to stop faking, to also be real with their fans. It doesn't hurt to tell someone, as you see me as a celeb, mimi siyuko right. Unaget? Kenya nafanya hapa hivi, it's for marketing, it's for content creation. But when it comes back to my private life, this is how I live. This is how you're supposed to live by.
And also maybe you should just take some time off from social media.
Exactly. It doesn't hurt to be off. Because if you look at, there are some statistics that were released a month or two. We are the most, as a country, we are the most social media users. For example, hii app ya TikTok. Worldwide, a country of 54 or 55 million people. This is not
It has the highest number of users on TikTok.
Yes. In its own way, it's a plus because it shows that we have a higher internet connectivity.
Or we are embracing technology.
We are embracing technology and all that. But on the other hand, how is it helping us grow?
And also we should also protect ourselves from the kind of content we want to watch, because you cannot be on social media watching some horror movie and then you're like, hey, huwa nashtuka usiku, but it's because of the kind of content you are consuming. So maybe we also have a role, like we have to protect ourselves when it comes to you have to choose wisely. You don't have to consume everything that we get on social media.
Yeah, be careful of what you consume. There's a saying that says, you only give out what you consume. Exactly. So if all I consume is wrong, or it's something that's negative, it's negatively affecting my psyche, that's what I'm going to give out to the community, to the people who are surrounding me. So be careful on what you consume online. As an adult, no one is there to put limits on what you consume.
Yeah, sure. So now when it comes to mental health, what are some of the signs and symptoms that we can look, and like the early signs that you can say, with these signs, I may need to see a psychologist. With these signs, my brother needs help. So what are some of the early signs that we should consider?
Well, this is a topic that we can talk day in, day out, when we will never get a definite answer. But there are some of the signs that are there. One is like, for example, if we are close friends, you see that people get to alienate themselves. Isolation is a part of, is a sign of mental degradation. Other things are like violence. Someone who was peaceful becomes violent. There are a lot of signs that you can see from people who are close to you. You personally, you're the one who knows yourself better than anyone else. You can know that this is the right me, this is the wrong me. You'll know that ideally I'm suffering from something, but people don't get to self-evaluate, or they don't get to evaluate themselves and see that there's a problem, because we mask it. Kuna zivitu tunaitanga zile blockages The term is running away from me. Zile defense mechanisms. So kuna zile defense mechanisms zenye kila mtu anatumianga. Kuna msee anakaa kwa dysphonia world. A dysphonia world is your fantasy world. And your fantasy world, you get to say that I'm okay as long as it's not affecting me, as long as I'm fine, it's good. For example, if you're suffering from drug abuse, you find that people say that as long as it's helping me cope up with the situation, it's not a bother to me, but in the long run,
it will ruin your life.
It ruins your life.
Okay, so talking about coping mechanism, we have seen people use different ways. One being drugs. Other people may engage in very harmful activities. I saw one guy who chose to cope with his stress through let's say sexual activities, like he could bring in women, you see. He was like the guy was the one prostituting, you see. Just like he could come from work and he was so stressed up. I'm like, okay, what can I do? He used to have all those numbers of different women he could bring in the house. But there are different ways you can cope up with your stress and depression, and from the daily activities that they can make you relax. So what are some of the effective mechanisms that you can use to cope up with the stress of the daily life, so that you can maintain a good health state?
Well, coping mechanisms vary from person to person, and there are negative coping mechanisms and there are positive ones.
Okay.
For example, mine is listening to music, taking a walk, and having time to myself, or self-reflection, and calculating, was this right? Did I make a right move here and there? And after my self-evaluation, I'll know, do I need further assistance? The forms that you have used, there is self-prostitution, and self-prostitution comes from, it varies from different to different. You can be sexually active. You can also be a social media prostitute. Prostitution is very wide. It's not like the traditional one we know. Prostitution comes in very different ways. So the modes you use to cope with your mental health should be something positive. Engaging in drug abuse, isolation, and a lot of other things, destructive coping mechanisms, in the long run, they don't help you. Because they give you a sensation of feeling that you're okay at that moment. But when it's done, you go back to your problems. And they didn't disappear. You just pressed pause. Then when you come back,
pick from where you stopped. Yeah, and also you can also add on that links about talking to someone. You can call someone, talk to a person, a friend of yours, a family member that you trust, or a psychologist. So, Joseph, when it comes to lifestyle, so what does what role does lifestyle play when it comes to your mental well-being? Like when it comes to sleep, exercising, diet. We have seen people talk about when you eat a lot of sugars, maybe you become hyper. So let's talk about nutrition, exercising, lifestyle in general. How can it affect your mental health well-being?
Well, a bit of history. 200 years ago, people were not that obese as we are today. Lifestyle diseases were not that common. That is because there was some sense of health and nutrition that they used. The formula that they used is not the same way we are living today. So today you get to find that a lot of the food that we are consuming, the lives that we are living, affect our psyche. If you don't exercise properly and you eat a lot, definitely you have to have these problems of your body weight, your physique, and nutrition. If you don't check what you eat, what you consume, it affects a lot in your body. You get to acquire some lifestyle diseases, kama diabetes and other chronic diseases that come because of what you consume and how your life is like. Your sleep patterns needs to be consistent. Not today unalala 3 a.m, kesho umelala 1, kesho kutwa umelala 11 p.m. You need to have a consistent sleep pattern, because this is gonna affect how you react with people, how your mental well-being is going to be like.
Okay, so let's say if I sleep at 11 a.m. and then someone sleeps and maybe there's another person who sleeps at 9 p.m. So like how does it impact my mental well-being?
Well, scientists say that best time to go to bed is 10 p.m. from 10 p.m. between 9 and 11 p.m. So if you sleep for around 6 to 8 hours, you're okay. But if your pattern is not that consistent, definitely in the long run, later in your life, you're gonna experience some problems.
Okay, so let's talk about stigma. There's this stigma that comes with mental health. When you come out to talk about how you are feeling, when you come, you want to express yourself more, you find that the people, there's this stigma that follows when you come out and say, you know what, I have depression. You know what, I am bipolar. You know what, I'm suffering from PTSD. So what are some of the stigma that are hindering people from seeking help?
There's a lot of stigmatization. We're not yet there that we can say we are comfortable in tackling this, because you find that if I come out today and speak about my mental health condition, not a lot of people are going to appreciate that, especially if you put it out in the social media world. In the concept of the male child, there's this toxic masculinity. Unafaa unaambiwa mwanaume hafai kuongea, mwanaume hafai kufanya hivi, mwanaume hafai kufanya hivi. That's how we have been brought up. That's the social context of the societal context of how people deal with mental health. But we need to make it something normal. We need to tell people that it's okay to talk, it's okay to cry, it's okay to come out and say, I'm suffering from this, and find your health support system. Health support system is not all about mi ni mgonjwa, I'm suffering from this disease, let me find someone who tunaweza ongea naye kuhusu hii kitu. But it also comes to the mental health being. Be a friend to that person who is suffering from a mental health condition. Yes, find people who don't judge you according to the situation that you are in. Be in a situation that supports you mentally. And if I come out to you, Veronica, I come out and tell you I'm suffering from this and I cry, you don't tell me mwanaume hafai kulia. Naget? Unaniambia ni aje it's okay to cry. It's a way of solving things. And an old saying says, a problem half shared is a problem half solved. Yeah.
So as we finalize, where can we get support? Where can we get resources when I have a problem? What are some of the places I can go? You said you work with Red Cross. What do you offer? Where can I get you? Where can I get a psychologist?
That's a good question. And with things that we offer is, one, we have a toll-free line for mental health. It's 1199. When you call this, there are counselors 24/7. If you call at any time of the night, you can get help. If you visit any office, Kenya Red Cross, you'll get help. You'll find a counselor there. Also in government hospitals, We work with them, and there is a counselor who is situated in any government hospital, whether it be a health center or a big hospital. There are those, you can get us there. So $11.99 is free for everyone. Call anytime, any place you feel like you need to talk to someone. It's free. You will get a counselor and schedule a session with you.
Okay, so thank you so much, Joseph, for coming. We really appreciate your time and your insights and contribution to this topic. And we hope that our listeners and viewers have learned something from today's episode. And just the way he has said, if you need help, please reach to Red Cross through $11.99. It has been another great episode of Med Talk Show. Thank you so much for joining us in today's episode. We can continue this conversation on our social media pages. Connect with us on Facebook, X, and LinkedIn. To you, our listeners on YouTube and our podcasts, you can also rewatch and re-listen to our episode on your favorite podcast platform. Thank you very much for joining us today. I've been your host, Veronica Kaveza. Until next time, I say goodbye.